Showing 9 o'clock, so we'll go ahead and call into session this regular workshop of the school board. And Dr. Hale, appreciate you sitting in for Superintendent Chambers today. And we'll move through and just let me know if there's a time that you need to say something or have folks come forward.
Thank you, Dr. White.
And colleagues, same thing, as we go through each item, if you have something, just let me know, and we'll cover that. All right, of course, the first item is called to order. Second is to approve the agenda. There is an agenda change on consent agenda. Added item 7.25, affiliation agreement between the School Board of Okaloosa, Florida, and Crestview Rehabilitation Center at the request of John Williams, Director, Okaloosa County Technical College. All right, 3.1 is a proclamation to recognize the month of September as Childhood Cancer Awareness Month, presented by Superintendent Chambers. And y'all help me remember that tonight this is an action item, okay? All right, Section 4, Administrative Personnel Appointments, we have none. Section 5, Public Comment. Section 6, Committee and Staff Reports, workshop only. 6.1 is in-county travel paid for August 2024, presented by Ms. Perry. And then 6.2 is out-of-county travel paid for August 2024, presented by Ms. Perry. That takes us to consent agenda, section 7. 7.1 will be the approval. 7.2 will be a motion to approve the minutes of the workshop meeting of September 9, 2024, and minutes of the regular meeting of September 9, 2024. 7.3 is the appropriation of District 1 School Board Member Capital Outlay Funds to Shoal River Middle School for band room flooring in the amount of $5,034, presented by myself and recommended by the superintendent. 7.4 is the appropriation of District 3 School Board Member Capital Outlay Funds to Shoal River Middle School for band room flooring in the amount of $5,000, presented by Ms. Ivanchek and recommended by the superintendent. 7.5 is the appropriation of District 4 School Board Member Capital Outlay Funds to Shoal River Middle School for band room flooring in the amount of $6,992.05, presented by Mr. Tim Bryant and recommended by the superintendent.
Can I just make a comment there?
ma'am.
So I just want to point out to the public that right there, this is just flooring for the band room at Shoal River, and 3 of us are donating to that. It shows you how expensive these kinds of things, that's just the band room that it's taken for us to do that. But of course, we're glad to work together for whatever we can for every school, but amazing how expensive everything is. Thank you.
Yes, ma'am. Thank you. All right, 7.6 is the appropriation of District 5 School Board Member Capital Outlay Funds to Blue Water Elementary School for clear touch panels in the amount of $6,178, presented by Mr. Heinley and recommended by the superintendent for approval. 7.7 is the appropriation of District 5 School Board Member Capital Outlay Funds to Edge Elementary School for hallway flooring in the amount of $15,540.16, presented by Mr. Heinley and recommended by the superintendent.
I'd like to
Yes, sir.
comment on that real quick.
Sure.
Mr. Myers and Bill Smith, they came to the table with that and are splitting it, and that's how that's going to happen. And the principal over there really wanted that place to be sparkling because next year is the 100th anniversary of Edge. So I appreciate that, Mr. Myers, Mr. Smith.
Thank you,
That's
Mr.
great.
Heinley.
Mhm.
All right, 7.8 will be invoices to be approved for payment, presented by Ms. Perry and recommended by the superintendent. 7.9 will be school donations by Ms. Perry and recommended by the superintendent. 7.10 is the payroll warrant register and accounts payable warrant register totaling $24,971,610.47.
Can I back up one
Sure.
to the
Which one?
donations?
Yeah, sure.
I just want to, being a businessman and being hit up a lot for donations, I just want the public to know that we have a great community that puts it in. I think the year-to-date so far is $143,614.79 from donations. Is that correct?
That's just since July 1st.
Oh, yes, that's huge. I mean, that's from our community, that's coming out of their pocketbook to support our schools. So that's
Very
it.
good. Thank you, Mr. Heinley. All right, so we were doing payroll,
Mhm.
and I think we were at self-health insurance claims and fees totaling $3,394,992.64, and bank transfers totaling $10,110,619.46 for August 24, presented by Ms. Perry and recommended by the superintendent. 7.11 is the amended district summary budget for fiscal year 24-25, presented by Ms. Perry and recommended by the superintendent. 7.12 is payment of a one-time bonus to district employees, presented by Ms. Perry and recommended by the superintendent. 7.13 is permission to pay a materials and supplies stipend to qualified adult vocational teachers, behavior analysts, behavior interventionists, mental health counselors, occupational therapists, physical therapists, school psychologists, social workers, staffing specialists, instructional coaches, ELA, math and science, and consulting teachers, presented by Ms. Perry and recommended by the superintendent. 7.14 is a tag-on bid purchase over $50,000 to Howard Technology Solutions, presented by Mr. Wyndham and recommended by the superintendent. 7.15 is a tag-on bid purchase over $50,000 to Trimark, presented by Mr. Wyndham and recommended by the superintendent. 7.16 is an amendment to service agreement number 25-42 Savas Learning Company, presented by Mr. Wyndham and recommended by the superintendent. 7.17 is sale and disposal of surplus property, presented by Mr. Bolton and recommended by the superintendent.
Mr. Chairman, I have
Yes,
a
sir.
question on that one.
Sure.
These are two ADA vans, is what I'm looking at. I'm not sure if I'm looking at it correct.
Yes, sir,
Welcome, Mr. Meyer.
Thank you, Dr. White. Yes, sir. They are ADA vans that we found out after the fact are not compliant with what the two schools that were using them. So they were no use to the school system. Now they're going to surplus.
And they're 2023?
They are brand new.
Wow. I mean, do we have a baseline on that auction when people?
We do not. We can set a minimum bid, but once it goes to auction, it is up to the highest bidder. Mr. McGinnis in Transportation has somebody that's interested in. We reached out to other transportation departments, and he's made some contacts that might be interested.
All right, thank you. So that takes us to 7.18, Biggs Inspiring Scholastic Success Grant Interagency Agreement between the School Board of Okaloosa County and Big Brothers Big Sisters of Northwest Florida, presented by Mr. Spolsky and recommended by the superintendent. 7.19, Employee Benefit Program Renewal for the 2025 plan year, presented by Sarah Cato, Director of Risk Management, and recommended by the superintendent for approval.
Yes, sir, Dr. White, if I
Yes, sir.
might. I'm going to ask Ms. Cato to come up, and she's going to do a presentation for the public, but I would just like to say to you all here at the dais, I'm very, very excited about what she's getting ready to say. I'm going to remind everyone that towards the end of our last plan year, we brought a premium a reduction to you all of 10% that you approved. And just on behalf of the superintendent, I would like to say thanks to you all for doing that for last year's plan, but also a thank you to all of the employees out there for the wonderful choices that they make that help us be able to do some of the things with our premiums and the different programs that we have. All credit to the BOG. I see Mr. Strong's out there, of course, Ms. Cox, and Ms. Appleberg, and of course our broker Accentria does a really good job of assisting us with making some of these decisions. But the credit to the employees for the great choices they make with regard to wellness, with regard to health care, all the different things that they do kind of helps us move forward with the self-insurance program and give us the ability to do some of the things that you're going to see through this recommended renewal. So, Sarah?
Welcome, Ms. Cato.
Hi, thank you. Good morning. So I just want to say thank you also to Accentria Insurance. Mr. Caraway and his team have really done a great job giving some ideas on how we can extract and make things better for our plans, not only fiscally but for our employees to make good medical decisions. And financially, Julie Perry, our CFO, has really dived deep and found some savings for us as well. And then to reiterate, the Benefit Oversight Group has really come together and made some really, really great recommendations as well. So let's get into it. So for our benefit renewal, one of the really great things we want to pinpoint here is our stop loss will decrease by 2.9%, which is very rare, and a lot across the counties and country. You know, really it's a big deal to have a 2.9%. You very rarely see that. It means we're making good conscious decisions, a good healthy employee populations existing at the moment. This is wonderful news. The Medicare Advantage plan has increased by 30%. The Centers for Medicare and Medicaid Services actually set those rates for the Medicare Advantage plans. And then for our standard rates, this is for basic life, and the employer side increased slightly by a 0.7 cents per 1,000, and our retirees' life insurance increased slightly by $1.71 per 1,000. The basic accidental death and dismemberment was no change. Now, the short-term disability increased approximately 19%, but to make that make a little sense, if we're looking, this is based on salary and age band, so it's going to be different for everyone. But just as an example, a teacher that's making $49,000 right now in the age band of 45 to 49 years of age, they're paying $12.62 a month. So that would increase to $15.03 per month, just so it gives you a little bit of a visual of what that looks like. And then all other current vendors are on guarantee rate holds at the moment for our contract years that we already have built in for them. Just as a little recap, our current benefit enhancements, we have our EAP with Ally Health, and you can get a licensed therapist and 10 annual sessions at a zero cost. They do legal services, they have childcare, they have coaching for life. There's all kinds of really neat resources in there. And then on the medical side, in the 2024 plan year, they were able to reduce by 10% the tiers for our employee paid portions. And then our wellness incentives were capped at $200. These are things that people can earn for doing little things like biometrics and going and have your wellness checked annually, those types of things. Ally Health for telemedicine, where you can call in and have a doctor treat you over the phone virtually, is at a zero cost. And then our Surgery Plus was also an added benefit that's now changing to the Lantern, so it's going to be named for something different. Same premise. Maybe they're just saying there's a light at the end of the tunnel because of surgery. I don't know. And then we're going to come to our recommended 2025 enhancements. So on our medical base plan, you're going to see added copays to certain categories, which are really going to help medically and financially for the employees. Because instead of having to come up with maybe the deductible first, you're going to actually have a copay for some things. And then a no increase in the deductibles on that base plan. And then the generic pharmacy is also changing. So instead of having to meet the deductible first and then having to pay 20% of that generic tier, it's now going to be a $15 copay. So that's going to be very, very helpful. Under the medical copay plan, there's going to be true copays there. So in the past, you had to meet your deductible first and then pay 20% of anything that the doctors could say you owe. This is the fee we've agreed to with UHC. Now you owe 20% of like $191. Now it's going to be a flat copay for them if you go see your primary care physician or a specialist, those types of things. And then no increase in deductibles in that. And then it's the similar for the generic pharmacy as well. You don't have to make the deductible first. You're going to pay a $15 copay for those generic tiered drugs. And then we are recommending to increase the wellness incentives from 200 and 250. One of the things they've added is the biometric screening at a little bit higher than it was before. It's now 100. Making sure you're getting your annual checkups, taking health surveys. You can connect a tracker. There's also little fun things in there. It traps sleep apnea, all kinds of different things. So there's ways of earning those incentives as they go along for each individual person. And then we're recommending additional reductions to employee plus child and employee plus family tiered rates for the base plan and the co-plan, which we just aforementioned there, based on the actuarial data from Accentria. So here's the meat and potatoes. This is our current monthly rates on the left-hand side, and these are your tiers, your employee only, employee plus spouse, employee plus children, employee plus family, based on each plan. If you look at the recommended monthly rates, you will see that there's a change for the employee plus children and employee plus family to the benefit of the employees, and you can see the monthly cost savings there in the red circles. And this is based on the 12-month payments per year, so it's going to be a little bit different for the 9-month, but I feel like this is a really great trajectory. Everybody's really worked together really hard to pull all of this together, and it's just a really great fiscally responsible choice that's been made, and we would recommend that we go forward with it. It's a great thing financially, especially for our employees.
This is phenomenal. Just, I can't tell you how excited I am to see this. So good.
And that's the end of my presentation.
Okay.
Thank you so much
All
today. I
right.
appreciate you.
Thank you, Ms. Cato.
Thank
Any
you.
questions, colleagues? All right, Dr.
Thank
Hale.
you.
No, but this is, I think, one of the things I'm most proud of, this board and our district, and over the years, especially since I joined the board 6 years ago, is how far we've come in our benefits. It's just amazing. And Ms. Cato, you weren't here, but my first year on the board, that came in, it was 12% rate up. Next year, 13%. And our board said, no, we can't do that. So to see this, it's just so good. And it's what a wonderful opportunity for our employees. We want to keep them well and to have this, and also good for us to perhaps bring in new employees who can see the wonderful benefits that our district is offering. So
Yes, that's a part of the benefit package, is not just what we're offering to pay them, but their benefits they're receiving as
yes,
well.
absolutely, and that's it's wonderful. I really appreciate the BOG. I know they spent hours working on this, but I think it's great. It's very exciting. I'm glad we can offer it.
Thank you.
I think it's shocking. I mean, I think it's incredible. In 32-plus years in business, private business, never had a decrease in health costs. It increases almost every year.
Yeah.
So, I mean, that's incredible. Good work.
Well, if
Dr.
you have a
Hale, good work.
decrease in cost, you have a decrease in service more than likely. I mean,
Yeah,
that's what's
exactly,
happened, yes.
exactly.
You pay more for deductibles,
Yeah,
you
you
may
pay
have a
more for
decrease,
less.
but you are getting it, they're getting it one way or the other, so nice job.
Well, the good news
Excellent.
is you guys have made some really good fiscally responsible choices, and you have a really good, healthy employee population. So those two combined together are really enabling this at the moment. So that's really good.
Great.
Thank you.
If I might, Dr. White, just one more thing to say. We do have open enrollment that's coming up soon, and so we would like for everybody to know about this information in advance. We plan on doing some different marketing and some different information just to kind of spread the word about what you all are talking about. But a large part of the marketing push will also be, and I think Mr. Strong would advocate for these too, are the enhancements that we are going to be adding to the program, because all the different things that we are recommending as new or part of the program on the medical side is to benefit the employee and their health specifically and aggressively, but you all know that improved health redirects our cost claims and allows us to do other things like that too. So it's really, really a good working group and a good program plan, and that we just want people to access those things like Ally Health. We've got several different components with regard to the Ally Health, and any increased utilization will only assist the employees and the plan. And I see Mr. Strong has a comment as well.
Yeah, if you don't mind, Chairman, Board. So an important piece of this is the employee's usage. So smart decisions. So that's something that we're also pushing out. You mentioned that, but that's a very important part of this, because if an employee has a cold symptoms and they wait till Saturday night and go to the emergency room instead of attending an immediate care facility, the difference in that is thousands. And it doesn't, to the employee, it doesn't necessarily seem like a big deal, but to the plan, when you have that happen continually, it costs the plan a tremendous amount of money. So education to the employees is one big part of this.
Yep.
Thank you.
All right, thank you, Ms. Cato. Anything else, Dr. Hale, on this item? Okay.
Good stuff.
All right, so let's go ahead then and move on to 7.20, Self-Help Project, purchase and install a sunshade on the playground at Edge Elementary School, presented by Dr. Smith and recommended by the superintendent. 7.21, Title I, Part A, Florida Department of Education approved project application for 24-25, presented by Ms. Dale, Title I, and recommended by the superintendent. 7.22, agreement between the School Board of Okaloosa County and the Community Development Institute Head Start Serving Okaloosa County, presented by Ms. Dale, Title I, and recommended by the superintendent. 7.23, application to the state of Florida for the Youth Mental Health Awareness and Training LEA Support Grant, presented by Ms. Terry Schroeder, and recommended by the superintendent. 7.24, memorandum of agreement between Accelerate Learning, Inc. and the School Board of Okaloosa County, presented by Ms. Stephanie Gillis and recommended by the superintendent. And then 7.25, school affiliation agreement between the School Board of Okaloosa County and the Crestview Rehabilitation Center for the Practical Nursing Program at Okaloosa Technical College for the 24 through 27 school years, presented by Mr. John Williams, Director, Okaloosa Technical College, and recommended by the superintendent. All right, so that takes us through those items and brings us to Section 8, Superintendent's Human Resources. 8.1, Information Only, Employees on Administrative Leave by Dr. Hale. 8.2, Information Only, Deferred Retirement Option Program by Dr. Hale. 8.3, Proposed Fiscal Year 2024-2025 Salary Schedules for School Administrative, Department Administrative, Managerial, Professional, Technical, and Temporary Personnel, presented by Dr. Hale and recommended by the superintendent. 8.4, Clear Certification Requirements and Issuance of Contracts for the 24-25 school year, presented by Ms. Duran, Program Director of Professional Services, and recommended by the superintendent. 8.5, Out of Field Report for 24-25 school year by Ms. Duran and recommended by the superintendent. 8.6, Employment Separations by Dr. Hale and recommended by the superintendent. 8.7, Personnel Recommendations presented by Dr. Hale and recommended by the superintendent. 8.8, Employee Transfers by Dr. Hale and recommended by the superintendent. 8.9, Employee Suspension by Dr. Hale and recommended by the superintendent. 8.10, Employee Termination by Dr. Hale and recommended by the superintendent. 8.11, Employee Termination presented by Dr. Hale and recommended by the superintendent. 8.12, Reinstatement Reimbursement of Sick Leave due to Line of Duty Illness, Injury, Medical Examination by Dr. Hale and recommended by the superintendent. And then 8.13, Leave Without Pay by Dr. Hale and recommended by the superintendent. At this time, there are no items on the discussion agenda on Section 10, Construction Program Owners Representatives Business. 10.1 will be a program status report by the board's representative. Ms. Gardner, do you have anything on that item?
I do
This
not.
time? Okay. And then Section 11 will be the attorney's business. Mr. McInnes, anything today?
One item, Mr. Chairman, I need to ask the board to schedule a special meeting for an attorney-client litigation session prior to your workshop on October 14th at 8:30. We need to discuss with you pending case number 2023 CA 001803F, which is pending in the circuit court in Okaloosa County, Florida.
Okay. Will you need a motion to that effect tonight?
Just asking the chairman to schedule the meeting.
Okay. All right, colleagues, so I'm inclined to do that. Okay?
Mhm. Yep.
All right. All right, Section 12, Superintendent's Business, there's some out-of-state field trips, and then 12.2, Dr. Hale, you may have some items.
Yes, thank you, Dr. White. I would like to invite Ms. Lightborn up. She's going to let the board know about all the various patriotic activities that we've been doing across the district over the past month. Ms. Lightborn?
Welcome, Ms. Lightborn.
Thank you. We just wanted to kind of sum up the month. We've kind of talked at the beginning of the month and the middle of the month where we were, and so we wanted to sum up the month. During the week leading up to September 11th, we shared testimonials with all of you and talked about the videos. We showed one video and we wanted to show one more. This is one of our SROs, so I did want to go ahead and do that. So
I'm Deputy John Wolfarth. I work for the Okaloosa County Sheriff's Office, and I am currently a school resource officer. From the years of 2000 to 2005, I was a New York City police officer, at which time I worked the event of 9/11. On the morning of 9/11, it was supposed to be my regular day off, and my cousin, who was also a police officer during that time, called me just upon waking up and asked me if I was watching the news, and I said no, and he goes, well, turn it on, and we watched the first plane had already crashed at that time, and he's like, well, it looks like we're going to be going to work today. And then momentarily after that, the second plane crashed, and he knew that it was bigger than just an accident. And he said, well, go ahead and pack a bag because we're going in, and I don't know when we're coming home. Not too long after that, due to lack of cell phones back then, it was all over the public radio, AM, FM radio, TV channels, that they were recalling all NYPD officers to come into work.
There's been a major collapse. We need additional units forthwith.
I lived almost 50 miles from my command. It probably took about 2 hours to make that commute because, of course, you know, everybody's trying to get somewhere in that situation. My command was probably about 15 miles, maybe 10 miles as the crow flies from actual ground zero. I could see the smoldering smoke in the air, but I couldn't actually see the buildings or, you know, the actual ground zero itself.
Have them mobilize the Army. We need the Army in Manhattan.
So at that time, we fought all the traffic because it was very chaotic. And once we got to our commands, of course, nobody could ever prepare for something of that nature. So it was just getting out onto foot patrol posts and being highly visible and just helping anybody that we could help. It was just security and presence at the time. After the events and the days after and weeks after and even months after, was just the cohesiveness and the togetherness of the community. You know, just everybody came together. It was amazing. People from all different facets of life that you wouldn't expect to be hugging one another or, you know, associating with each other, just all came together. So that was amazing. I mean, I've always been one to enjoy helping people. That's why I do the job that I do. And, you know, that day was no different. It was just on a grander scale. So for those of you that weren't alive or around back then, I would ask that you be aware and conscious that things like that can happen here at home, and to remember those innocent lives that perished on that day. And also, I would like you to remember all of those that still fight for our freedom to this day.
So, again, pretty sobering. So Constitution Day was September 17th. Again, we talked about this and all of the things that were going on within our schools educationally through academics on that day. And then this is some pictures at Pryor of some of the things that they were doing during Constitution Week, some very active learning, just some really good stuff. They were deciphering, decoding the preamble, et cetera, so really good. And then this week, the 23rd through the 27th, at least 3 hours of instruction on the intent, meaning, and importance of the Declaration of Independence will occur through social studies, and students will recite the preamble of the Constitution at the beginning of each day. So we will be summing up Patriots Month with this. And that's it.
Awesome.
Really good stuff.
Yeah,
Thank you.
good stuff.
Thank you.
All right. Thank you, Ms. Lightborn. All right, Dr. Hale, anything else?
I believe that will conclude it for today.
All right. All right, very good. All right, so that takes us now to board members' announcements and requests for information, although we do have some items this evening. And Ms. Mary, I'm going to ask you to help me as we kind of go through these different service opportunities for board members. All right, 13.1 will be the designation of a school board member to serve as the board's representative for the Educational Support Professional of the Year Selection Committee. And so, Ms. Mary, do we have someone that was serving in that capacity in the past?
These are yearly appointments. So
Okay.
it's just time for it to be renewed.
All right, and who served in that one last?
Dr. Kelly.
Dr. Kelly? Okay.
She took I was out of town and she took my place.
Okay,
So graciously
all right,
took my
all right.
place.
So, we can discuss this a little bit now. We can't formalize a decision, but is there anyone that might be willing to fulfill that position?
Well, first of all, where does it stand with Ms. Gardner's position in moving off the board in November? So now I think the ed support is before you c-
Correct,
go?
correct.
Okay. But the teacher of the year is not done before you go, right?
Correct.
Okay.
And also the
Principal.
principal would be afterwards.
Okay, so there's really only one that you would be eligible, right, for you to do? Yeah, okay.
Correct. And unfortunately, it is the same. I looked at the schedule and same thing's happening this year as last year. I will not be in town. I don't think I will be in town on the Monday, I believe, Patrick, the first Monday. I've already looked.
What is the date
It's October the
that you have?
14th, is it? I
Okay,
just-
yeah.
what- I'm afraid to commit myself to that because
Sure.
I did get caught and not
Yeah.
able to make
Yeah,
back a meeting
okay.
because airlines.
Gotcha.
But,
Yeah,
and I'm,
and so when this came up at the agenda planning, I asked Dr. Hale to help me make sure that these were appointments that we needed to make at this time, given the fact that we have some board members rotating on and off.
Mhm.
And so these have stayed on the agenda, with the assumption being that these are needed to be made tonight, given the schedules of the different.
That's right. I would, so just the announcements, maybe down the road, but the processes begin now leading up to those. So there's a lot of different things that are involved that would require that.
so these all need to take place prior to Mr. Destin coming in on November the
That was the question I
19th
Yeah,
or
that's-
20th.
Right,
Yes, that
and the
was
answer was
mine.
yes.
I'm guessing, Dr. Hill,
Yes,
that's,
yes.
all these need to take place prior.
Yep.
So just for informational purposes,
Mhm.
so the ESP of the year.
Yeah.
We send the packets out October the 2nd. The first committee meeting is October the 10th, and the selection process ends on the 15th of October.
And
All right.
and that's my conflict.
Yeah, okay.
I thoroughly enjoy doing this, and if I could, I would change plans, but I'm afraid I might not be able to.
Okay.
And I'd hate to commit to it and have to have what happened last year happen again.
All right, so in the past, Dr. Kelly served in 13.1.
Mhm.
All right, what about 13.2? Who served as the Teacher of the Year committee?
Dr. Kelly.
Okay.
Yeah, she took it, yeah, she did
All
both
right.
because she was
She took
helping
my
out.
place,
She was
yes.
helping
She-
out.
and it's a
Mhm.
2-year
Yeah,
commitment.
because she took it from me the year before, okay.
Okay.
And
And
then-
this is the value of a workshop. We can discuss this now.
Right, and then you did the principal of
I
the
did
year.
the or did I?
What'd
I
you
did the
do
principal.
this last
I-
time you
I
did?
did
Okay.
that. I may have swapped with Dr. Kelly, and I did the principal.
Okay,
And that's 13.3.
Yes.
right.
Okay.
Mhm.
All right.
And just so that you're aware, the principal and the ed support, we were not out actually at the individual's work site. It was basically reviewing the applications and then making our recommendations. On the ed support one, we did have the opportunity to meet the top, what was it, 5 or 6 candidates at that point. But the teacher of the year was one that who whoever represents the board did go out and visit. Just
All right, and I
explanation.
did, in the past, I did the principal of the year before. And so, even though I'm serving in this capacity, I'll go ahead and pick up the principal one again, okay? So, that leaves two slots we have to fill. 13.1, do we have a volunteer?
I can pick up the non-instructional.
All right, so then 13.2,
Well, and I hate to
it's okay, we
offer
just,
someone who's not here, but I know that Mr. Bryan always enjoyed, but you are here, Mr. Henley, so if that's something you would enjoy.
I'll
that's-
do whatever you need.
okay, why don't you, when Mr. Bryant returns, y'all can discuss it if we need to
Arm
change it.
wrestle?
Yeah, but we'll go ahead and, because we need to make an appointment.
Yes.
That's the
Yes.
bottom line. And although NATO has had some interesting situations when a member wasn't present, we don't want to do that here. So, Mr. Heinley, then tonight, then we'll make that motion, okay?
Okay.
Because also when we, what do we call it in November? Reorganize. I lost
Yeah.
that. There'll be some other things coming up too.
Quite a
There are
few.
others more than that. And then also, I just got put on the health board with Ms. Schroeder. And that's not a votable one, but she put me on that. So there's a lot of things on, that's
Get
fine.
drafted.
I'm glad to do it. And so there's a lot of different opportunities for us to be in different groups.
Okay. All right, well, that's good. We got that worked out. And then 13.4 will be board members' business. So let's kind of go ahead and do that. Mr. Heinley, do you have anything for today?
I have two things. Ms. Perry, was this going to be discussed at all in the future, your work on this, or is that just informational purposes? Well, I'd like to give kudos. This is a lot of information right here, and this started with my Finance 101 that she started teaching me about financing of a school district. Is very complex. And so she started with us comparing to Walton County, which is huge. I mean, huge. It shows us how much money we're bringing in and, per student. And then I asked her, I said, can you tell me what all 67 districts are? And so she got into her spreadsheets and she did all this information. And it breaks it down by district, and it breaks it down by sorted by grade. And just a couple quick hits here. I mean, we're doing really good for money-wise, fiscally, compared to what we produce. So there's 32.8% of the schools in Florida are A grades, and of course we're one of those. And 62% of those 22 schools get a lot more money per student than we do. So basically, this says that Okaloosa County School District is doing more for less than a lot of the districts out here. And I mean, this is spreadsheet geek stuff, but it is great information. I really do appreciate it because I can pull this out and talk to the constituents and say, look, here's where we are and what we do. It is really good information. My second item for the board, and you, Dr. Hill, since you're sitting in the seat, today is the 23rd.
I got it.
Who's the 23rd President of the United States?
I got it. Benjamin Harrison, who's the grandson of the 9th.
Very good.
I got ready. I did my homework. I wasn't going to get
Dr.
you.
Hill, you got
Ready?
lucky.
Yeah,
All
I
right, very
remembered
good.
it.
All right, Ms. Evancheck.
I do. I'm happy about that. Okay, yes. First of all, it's Baker's homecoming, so if the storm doesn't affect us, we're going to be having homecoming. And I've said it many times before, if you haven't gone to a Baker homecoming parade, which is out in the community, you've missed an event. So I'll be riding in the parade Friday afternoon unless we have some inclement weather. So I'm looking forward to that. On a more serious note, I know Superintendent Chambers is not here, but I do want to state how much I appreciate the message that he put out in regard to school threats. You know, he put out a message earlier, about a week ago, about that. And as many of you have seen, that has become a real issue in our schools, not only here, but throughout our country. And he put a very strong message out. And I didn't know if board members, we wanted to tack on to that. But I, as a board, to say that we will do everything we can in our, that as far as our power and that legally we can do to make sure that anyone that threatens anyone in a school, that we will prosecute that, because I think that is very serious. And I think sometimes what these students that are doing this, or people that do this, don't understand what happens when something like goes on in a school and the resources that are wasted. And I just think we need to make sure that those individuals are punished and that we can start deterring some of this even before it happens, to know that we're not going to tolerate. We have a zero tolerance policy of anyone threatening anyone or anything about a school. And so I do appreciate that the superintendent put that message out, and he made it very clear that we won't be doing that in Okaloosa schools. So thank you.
All right, thank you, Ms. Evancheck. Ms. Gardner?
I'm going to say also that was an excellent message that Mr. Chambers sent out, and I'd like to see that message continue, ongoing, not just this one time, but also to make certain that it's also, that message is delivered in our schools also, especially some maybe our middle schools, high schools, excuse me, that the students hear this message, that it is zero tolerance.
Yep.
All right, thank you, Ms. Gardner. All right, so that'll take us down to public comment, and then let's go ahead and take a look at the public hearings we have this evening. 15.1 will be a public hearing for instructional materials adoption for secondary science and career and technical education, reproductive health and disease education, presented by Ms. Ellis, science specialist, and recommended by the superintendent. 15.2, a public hearing for adoption of revised school board policies, Chapter 2, Fiscal Management, presented by Ms. Perry and recommended by the superintendent. 15.3, public hearing for adoption of revised school board policy 06-42, Progressive Discipline for School Safety Violations, presented by Dr. Hale and recommended by the superintendent. And then 15.4, public hearing for adoption of revised school board policy 08-09, Duties, Ethics, Professional Conduct, presented by Dr. Hale and recommended by the superintendent. And after all that, that brings us to adjournment. But before doing so, are we good here, Mr. McInnes and Dr. Hale? Anything from you or staff? All right, colleagues, anything? All right.
Is
Anything from-
Mr. Bryant going to be here tonight?
I'm not aware.
That's very convenient, since the Bulldogs lost to the Eagles, and he's supposed to be wearing a Eagle shirt.
I know.
Dr. White, I would just offer
Yes.
one thing as we depart. I know Ms. Evancheck alluded to the impending weather, and there will be information going out today notifying the district as to where we are right now. And as you know, we will update constantly as we know more.
Yep, you guys do a good job with that. Appreciate it. All right, anything, Patrick, from the union? Okay, we're good. We're adjourned.